4 chambers. 2 upper chambers, the right and the left atrium, and 2 lower chambers, the right and the left ventricles. Fibrillation describes when the muscle fibers are all contracting at different times. So the end result is this quivering or twitching movement. Normally, an electrical signal is sent out from the sinus node in the right atrium. It then propagates out through both atria super fast, which allows them to all depolarize at about the same time, and you end up with this nice coordinated contraction of the atria. That signal then moves down to the ventricles and causes them to contract shortly after. With atrial fibrillation, or AFib, or sometimes AF, signals move around the atria in a completely disorganized way that tends to override the sinus node. Instead of one big contraction then, you get all these mini contractions that make it look like the atria are just quivering. On an electrocardiogram, or ECG, normally the P wave corresponds to the atrial contraction, which is followed shortly after by the QRS complex, which is the ventricular contraction. During AF, all these small areas are contracting at different times, so you end up with this scribble sort of looking ECG, each little peak corresponding to one spot in the atria twitching. Sometimes a signal from one of these areas make it down to the ventricles and cause ventricular contraction. These contractions and QRS complexes are interspersed at irregular intervals though, and usually at fairly high rates between 100 and 175 beats per minute. In the normal heartbeat, a well-coordinated atrial contraction does contribute